In this demonstration, doctors, we're going to graduate to instrument-assisted manipulation, which is a nice tool to have, as we all know. There are those patients that will either have absolute or relative contraindications to spinal manipulation. And so for those patients, it's a good idea that we have some options, which we're going to take a look at now. Maybe a scoop just about 6 inches to your left. Perfect. One of the things I like about instrument-assisted manipulation is that we can still invoke some of the reflex phenomena that occur with the adjustment. This has been well studied and published ubiquitously in the literature. And certainly the reflex phenomena that occur are, number one, we have the release of endorphins, which is nice for folks that are in pain. There's also reflex muscle relaxation, improved circulation, and then finally we have the proprioceptive bombardment, which also attenuates nociception. And then finally, we actually have the biomechanical effect of the instrument. One of the advantages of instrument manipulation over traditional manipulation with our hands is that we can actually perform the maneuver going through a full range of motion. So let's say Betty Jo has a rotational restriction at C2, C3. In this particular case, I'm going to make my contact point on the articular pillars, and I'm taking my tissue tension with my thumb. Once I've got my contact, I'll go ahead and stabilize the head, and what I'm going to do is have Betty Jo bring her head back up into neutral, and as I adjust, I'm going to ask her to rotate her head to the left. So as soon as you feel the first impulse, Betty, why don't you go ahead and start rotating. And we can repeat the procedure as necessary. There's lateral flexion, pretty much the same procedure. We'll make our contact point on the lateral aspect of the articular pillar. Take our tissue tension. And again, in this case, we want to make sure that we're considering our vector, which is going to be somewhat inferior to superior and medial to lateral. So I'm going to bring your head back up into neutral. And as soon as I start the instrument, I want you to laterally flex this ear down to this shoulder. For posterior restriction, if it's unilateral, the single tip applicator is fine. If it's a bilateral issue, then we certainly want to consider using the dual tip applicator.